Woman. Bob is staying back for our second conversation, and I'd now like to call on another member of the House Ways and Means Committee, Congressman Patrick Meehan. Healthcare-related issues are top of mind for the representative, and he has received recognition as a supporter of medical innovation. Congressman? Bob, back over to you.
Hello, hey, Congressman, how are you?
Nice to see you.
Yeah, thanks for joining us.
Thank you.
First off, I saw that you were a referee in the NHL for a couple of years.
In a previous life.
What was that experience like?
Well, it taught me we should need a penalty box in Congress.
There'd be a lot of people in that box, I think.
I think it would be well utilized.
Big question, but want to start off, where are we with the current healthcare system regarding treating patients with rare, chronic, and inherited diseases? And where do we need to go?
I think we're in an exciting place.
Okay.
We're seeing for the first time real breakthroughs in research and the application of that research in a broad spectrum of approaches, the continuing utilization of drugs and therapy with drugs themselves directly, but the topic today, gene therapy and things in which we're beginning to use the individual's own immune system to attack the diseases. This is coupled with a greater appreciation with the scope of information that's available today, more personalized medicine. I think, lastly, the ability to collect information in remarkable new ways that was never available before. So the literal tests where we used to have to find a patient population inside a city of Philadelphia to do a study, there's now the capacity, if we do it correctly, to have information on thousands of patients, perhaps worldwide, in a very narrow category to be sure, but to be able to find things that will allow us to garner the information, to make the calculations about what might treat an individual's disease. So it is an exciting time. And obviously the question is, how can you make that available? How can you continue to incent the development of these products? And then once those products are on the market, how do you find a fair price and a mechanism to assure that they're available when they've proven themselves to be effective?
What's the Ways and Means Committee doing on this issue? We talked about tax reform. I know that package is coming soon, but what is the role of Congress and specifically your panel?
Well, it's broad. First, of course, is to treat these businesses not just as an individual entity, but to make our businesses more competitive, not just here in the United States, by giving them more resources to invest back into their own business models, but globally as well with a more competitive tax system. And I'm working on very specific things that will incent businesses like our research organizations to want to begin to continue to do business here in the United States. Right now, there's too many incentives being offered by foreign countries for you to take your research operations and move them overseas for a variety of reasons. Such things that a bill that I have on contract research organizations. We're seeing more specialization with a broad spectrum of costs associated with bringing a new drug. As with so many other parts of business in the drug area and other therapies, we're beginning to see specialization in which outsourcing could be done to help the efficient and effective production of, that study where somebody can keep the records and do it appropriately, but it's an outside organization. They don't qualify for the same research tax credits. So we want to try to extend those to some percentage. Those that go to the original manufacturer may also extend in some capacity to the contract research organization. So we continue to develop this sort of dynamic industry, and we incent it to continue to stay here in the United States or to return.
Are you hoping to get that measure into the tax reform bill that the committee is working on?
Yeah, I do.
Okay.
I hope so. I mean, obviously, we're running against parallel themes. One is simplification. And that means that you start cutting down on the kinds of special tax breaks that are out there. But I think that with 20th century cures and the recognition of how vital research is to the continuing movement, I mean, I see this as one of the spaces in which I would suggest there's going to be continuity in this space.
Along the lines of the 21st Century Cures Act, that was something that I don't think got the attention it deserved. There wasn't there was some conflict, but there wasn't as much fighting as we normally see in the healthcare world. So does the passage of that bill, which went down to the wire, as you know, and with some changes, do you think that Congress can fight over the Affordable Care Act, Obamacare, and still yet move bipartisan legislation on other healthcare issues?
Yeah, I think we can, to be sure. At least we can start to develop the policies of how this is going to be done. Obviously, it all comes down to big packages that end up with one vote. I mean, that's the difficulty. We don't segment this stuff out, so you've got one bill that moves or not. But I think that the more fundamental question is, are we going to step back and look at ways in which we are ultimately delivering health care? And we're moving towards, critical parts of what the Affordable Care Act did, I think, effectively, were the beginning to explore ways in which we could do more value-based payments or pricing for services and other kinds of things. And now, of course, we're looking at value-based pricing for the actual drugs and therapies themselves. So as we move away from a fee-for-service system and we start to look at the care for the whole patient, and we begin to look at the concept of collaborative relationships in delivering that care, then you begin to see that this is disruptive in a certain sense. I mean, people always talk about disruptive technologies, and I actually look at this and think we need to be that way. We've got a system that's been set this way for too long. There's a lot of good things about it, but this is one of the places in which we rethink how we deliver it, and in some ways, this concept of the cost of drugs, because these new therapies are coming on, which could be life-changing.
Sure.
Yeah, a one-time therapy that does away with a disease. We can't turn our back on that. And yet, how do we begin to pay for it? Well, we have to start thinking about new ways. As soon as you start calculating value-based payment systems, you begin to see that as something that you should be considering all across the healthcare spectrum. And maybe it makes us rethink in a better way how to do this more effectively, deliver quality, and make sure that it's at an appropriate cost.
And how do you do that, though? How do you? I mentioned earlier that the FDA recently approved a leukemia drug and cost $475,000. What is fair when you have the market involved? We have companies like, well, listen, we don't want to invest R&D unless it's going to prove, we're going to make some profit. We're in the for-profit industry, but then you have the patients who are saying, I can't afford that.
Yeah, this is a great question. So you began with what is fair.
Right.
And what is fair is always a calculation dependent on who's looking at it. So we have to see that you see various perspectives. Let's start first with the patient, most importantly. Mm-hmm. What is fair to them is getting the availability of something. Suddenly, I have a child who can't see. Tomorrow they will see for the rest of their lives, or presumably they will. So what is fair is how do we calculate what the value of that may be? Now, we may know with something like a treatment that we could have for some other kind of heart disease or something, you could calculate the costs that would be incurred if we continue to have to treat this chronic disease versus the failure to have to incur those, like we do with the breakthroughs in one of the other areas. But, the cost associated with those versus, the one-time payment, so you can probably make a calculation on that. What's the cost of being able to see? Mm-hmm. What's the value of that? I would suggest if I was the parent of that child, I would want to see paid whatever I could to bring that child's life back into its fullness. But we've also got to recognize, okay, how do you calculate, well, what did it cost the manufacturer to get there? So we look at that as a factor as well. And then we begin to say, well, how can we pay that cost with an upfront payment? And this is where we begin to look at the collaboration that takes place, in which we start to experiment with guarantees that are paid by the manufacturer for the duration of the cure, so to speak, ways in which there could be creative financing to be able to do this. And we need to appreciate that this is the space right now where we're seeing, I think, the evolution of the next generation of how we look at drugs. Because you have to understand, it's not all the same. We've made remarkable progress in holding down the delivery of effective health care with generics. And there's a lot of drugs that have now been brought into the generic market, and most people are covered by these. In the future, though, 50% of the new costs by the end of, I think, 2021 are going to be associated with therapies that go in sort of specialty drugs. And they're going to be expensive. And so that's where we're seeing the divergence. So we want to continue to explore the ability to do things like generics and others for this round of drugs. And then we need to appreciate this second tranche in which we're going to see the innovation, and we've got to be able to follow that with certain kinds of policies that will encourage continuing research and development and potential financing of that, but also cost controls and other ways in which we can assure that they can be delivered in a fair fashion.
Do you see that the possibility at some point during the Trump administration that President Trump has talked about prescription drug pricing, and Democrats and Republicans, some Republicans have said, listen, that's an area we can work on. It's a thorny issue, though. It's not easy. But do you think that's one area where there could be some type of an agreement at the legislative level?
Yeah, but this is, I think that's why I went to that explanation. The problem with all of these issues is they're always more complex than they're made to be. And people just want to throw everything into this simple solution where, okay, we're going to, we are cutting down on the cost of drugs dramatically and have been, but we need to appreciate that there's this, again, second tranche that's growing because of the costs associated with the research. There's things that we can do administratively and otherwise. Tom Price and Verna and others are working very, very hard to cut out, more of the costs associated with the time and duration of that. There's things we can do to bring that down. And I'm working on things with Stark and anti-kickback and others in which we can incent companies to be able to work with payment schemes and introduce their products into the market without having to feel the impact that they're going to be affected by federal laws, which had a good purpose before, but are now counterproductive. We want to be able to allow a manufacturer to introduce a discount into a population, a Medicaid population, without having to worry about getting whacked with a best price suit. I used to bring those suits. I was a U.S. attorney. But I look at those now and realize that in the past we thought people were gaming the system. Now we need to create the system so it's an incentive for them to not be impacted by those laws.
How do you think the role of FDA, providers have complained about them, patient advocates sometimes complain about the FDA approval process, too slow, too burdensome. Do you think there could be improvements there, part one, and part two? The House has received legislation from the Senate on right to try, legislation that passed the upper chamber overwhelmingly, and now it's in the House's seat. That's a lot of the versions of that bill have been passed by various states, but do you think that's something that the House will act on?
Yeah, well, first, I think there was a lot of progress made. 20th Century Cures and others look, and I sometimes think the FDA gets a bad rap for the people say they're unwilling. There's been a lot of progress. PDUFA and other things have enabled there to be more movement towards a quicker way, and FDA has expedited things where they see some evidence. I'm not as familiar, honestly, with the second piece of what you asked, in which people want the right to try. I guess my instinctive fear there is that there's always a potion around the corner that's going to save things. And if something, there's movement towards some sort of community agreement. By that I mean the researchers and the healthcare providers and others that are looking, they're saying, we're making progress here. Our objective is to find the real places where we're making progress and not be afraid to take risks where the signals are that we're moving in the right direction. The fear that you have is that you start hocus pocus medicine in which people are being promised things that really don't have an impact. Or maybe what's often the problem is that there's multiple issues at play with an individual, and sometimes something may appear to do something for one person, but it wouldn't be replicated in another. So I don't know about that. I have to give some thought about where I am on that space.
As you know, the House passed repeal and replace. The Senate did not. From the House's perspective, are you waiting for just the Senate to move something, or do you think that something else could move in the House? What is the latest on that?
I think something will probably, if there's progress to be made, and I think there will be, I think Lamar Alexander and Patty Murray will probably work on their committee at ways in which we can shore up the risk-based, the risk corridor type system, make sure that there's some sort of payment mechanism associated with that to allow the stability of the marketplace to sustain itself. Maybe look for a few other kinds of innovations in that space. But my sense is that it's more of an operation designed to assure that we don't move backwards where we are, begin to look for some kinds of improvements which could have been made. I continue to fight against the medical device tax, which in my backyard, you look at something which you say is counterproductive in the end. So something like that might be tacked on to the things that they're moving.
That has bipartisan support. Yep.
It has traditionally, yeah.
Yep. We'll open it up for questions. As I mentioned earlier, we have people in the audience. You can ask the congressman about health care, tax reform, the upcoming hockey season. Way in the back.
Congressman, so you raised an interesting point there about how we ascribe the value of curing blindness, of curing a specific disease state. As a company, as a CEO of a company, operating from the same kind of mantra as Spark here, developing gene therapy-based treatments that have the potential to be one-time use treatments. If we take the example of HIV, where we pay, or where Medicare or insurance providers pay about $3,500 every quarter for patients for the rest of their lives to treat that disease, as compared to an HIV antitoxin through gene therapy with the potential to eliminate with a one-time only use. It seems like in those cases, the value of government subsidy, of Medicare, providing for cures over chronic treatment is very clear, but it would require a very strong and aggressive posture by the congresspersons overseeing and the agencies overseeing the use of Medicare. In other words, ties would have to be severed with obsolete companies in order for us to actually engage the easiest value of delivering the best possible treatments in the here and now.
All right, well, I don't pretend to understand what you mean about ties needing to be released from obsolete companies. I think what your point was that there are costs associated with the continuing care, which we can calculate to some extent for any chronic disease, or many of them, and to the extent that you look at a one-time cure versus the average lifespan of those people who will live with that for a period of time, that right and then and there is the beginning of one factor of a calculation. A second is, what did it cost you to bring your product to market? And there's certainly a value associated with the cost that you can calculate associated. Now, the third piece is we don't want to disincent your investors from realizing a profit if, in fact, you bring something to market. But what's a fair profit for that? And are you looking at something in which there's been a quick breakthrough, but the value is you're going to save a lot of money. It costs you a little bit to bring that to market, but there's going to be remarkable profits now associated with that. And I don't know how you calculate what is fair in that kind of a context, but it's a consideration that's going to have to be made. And lastly, we're making decisions today that you've got a therapy that says we're going to cure this disease. But we don't know that 30 years down the road, do we? Because we don't know, just like with cancers, where something can be in remission and 9 years later come back. So how do you make a one-time upfront payment, look at a lifespan, and then calculate how we go back and claw back for whatever payments were made if, in fact, the individual isn't, has a changed circumstance that the therapy didn't do what it said. So maybe there's some kind of a long, both agree that almost like a mortgage, that you are paid over a period of time. And so long as that individual continues to live, disease-free from that state that you've treated, there's some kind of periodic payment that's made to recognize that. And you can go out in the finance markets and have somebody upfront that cost. I mean, there's just going to have to be a lot of thinking. And I think people are all going to have to be creative in how you get to a smart solution.
Probably one more question.
Oh, thanks. Thank you. I wanted to get back to tax reform for a sec.
How you do, huh?
Just the question. In terms of repatriation of overseas dollars and a reduction of tax rate, do you see that being included in tax reform? And if so, how do you think it might be paid for?
Yeah, I see it. I see it being potentially included. I see it being likely to be included. First, you're going to probably look at a territorial-based tax system. And the dollars that could be coming back would come back in two ways. I mean, a recognition, some's cash, some is hard assets that are over there, and it would be repatriated at a very, very reasonable rate. Way much better, somewhere in the single digits, much better than the high, 30% plus rate you'd pay today. But it would be a deemed repatriation probably too. It wouldn't be so much a one-time deemed repatriation is likely what I think you would see. And then what happens with it once it comes back is another question. You have some people arguing that there's ways in which if it's going to be incented to come back, we also have to have conditions on how it can be utilized. Last time people were unhappy, a lot of it just went to corporate bottom lines. Other people want to use it to underwrite healthcare. Other people want to use it to underwrite infrastructure. There's a lot of questions about how it could be used. What's that? Well, repatriation, when you say pay for, I guess. CBO scores it as a cost. Yeah, we're going to have to deal with a lot of issues with regard to pay fors. That becomes a question about, does it incent growth, and are people willing to look at whether we need to get to something that is going to be revenue neutral, or whether it's going to be an expectation that you can sustain some recognition of growth potential. I mean, look, we're going to have to get into the pay-fors for all of this stuff. That's where the real heavy lifting is going to be.
When do you anticipate the committee either holding a hearing or a markup, or when bill text will be released?
There's a lot of work that's been going on. We're working as we speak. My instinct is you're going to start seeing something this fall, maybe earlier than later, before the holiday season, certainly out of the House and over into the Senate, in which the outlines of a program, where it all goes with the Senate. I think that there's been collaboration on the part of the White House, the Senate, and the House to try to get on the same page about where we're going, so we're not seeing different approaches, so that what comes out of the House will already have been vetted to a fair extent with the Senate, and frankly with the White House as well. That may suggest a path in which there's a little bit quicker movement, but these are always very, very complex things. I think everybody'd love to see this before Christmas as the nice Christmas package before the year, so that you could begin to see planning into the next year that would be able to factor in what the tax situation would be. But there's a lot between here and there.
And one of them being you have to pass a budget first to get reconciliation protection. And a lot of members we hear say, well, I want to see what the tax bill is before I'm voting for the budget.
Well, that seems to be, there's goalposts that are continuously moved. I don't know that that's a fair expectation with regard to, you can talk about there's already some policy out there that isn't secret. The blueprint worked with a lot. You see some changes in that, but there's always people who can find ways to say no. And another criteria for why you ought not. I think we expect that this is going to be a tough issue, but the budget is one thing and tax reform is another.
Well, we've run out of time. Please thank the congressman. Appreciate it.
Thank you.
I hand it over to Joanne.